Welcome to the NIH Healthy 2018 Facebook Live event. Facebook Live event. We are all very excited to be here today to talk about the ways in which we all could be healthier in 2018. We will focus on 4 key areas. One is stress management and anxiety. The other is healthy aging, then smoking cessation and kicking bad habits, and diet and exercise. I'm one of the 4 panelists here today, and we are all from different institutes of NIH, and we will take turns and introduce ourselves. I'm Rezvan Ameli. I'm a clinical psychologist from the National Institute of Mental Health, or NIMH. The mission of NIMH is to transform and the understanding and treatment of mental disorders through basic and clinical research to advance prevention, recovery, and cure. My colleagues at the NIH study conditions such as anxiety disorders, depression, bipolar disorders, schizophrenia, autism, attention deficit hyperactivity disorder, PTSD or post-traumatic stress disorder, suicide prevention, and other related topics such as coping with acute trauma. I'm the NIMH representative at the Clinical Center Pain and Palliative Care Service. I specialize in cognitive behavior therapy, also known as CBT, and mindfulness-based therapies. Today I'm here to talk to you about stress management and anxiety. Now I'm going to turn to my colleague for her introduction.
Thank you so much. I'm Dr. Nicole Redmond. I'm a medical officer with the National Heart, Lung, and Blood Institute. Our institute is focused on the prevention and treatment of heart, lung, blood, and sleep conditions. And I'm here today to talk to you about all of the habits that we want to start in 2018 or continue in 2018, focused on the prevention and management of heart health. And I'll pass it on to my colleague.
Thank you. I'm Dr. Erik Augustson. I'm a clinical psychologist and behavioral researcher at the National Cancer Institute, or NCI. NCI is perhaps the world premier research institute when it comes to dealing with all aspects of cancer. So the research portfolio spans from prevention, which is the kind of work that I do, early detection and diagnosis, treatment, all the way through to cancer survivorship and the end of life. Now, in addition to the research that we do at NCI, we also do a number of large implementation projects, and I have the luck to be the lead of the smokefree.gov initiative, which is the largest federal health behavior mobile health intervention program, which is quite a mouthful. And hopefully we'll have time later today to talk some about the resources that we have available in smokefree.gov.
And I'm Dr. Marie Bernard. I'm the Deputy Director at the National Institute on Aging, or NIA, and I'm also a geriatrician. Our institute is focused on all of the conditions associated with aging, from the very basic biology of aging to the clinical presentation of illnesses in older adults to what happens at the population level. We additionally take the lead on behalf of NIH and the federal government in Alzheimer's disease research, and we thus are leading the very important search for a cure for this devastating illness, as well as lots of research on what can be done to support people living with dementia and their caregivers. I specifically asked to be on this end of the row of presenters because much of what one needs to do in healthy aging is dependent upon what you do when you're younger and the skills that are represented by my colleagues here.
Thank you, Dr. Bernard. So it's great to have everyone here, both in terms of the people on the panel and also of you who are watching right now. If you're just joining us, this is a panel that includes individuals from institutes across NIH, and we're here today to answer your questions about how to try to live a healthier life in 2018. Now, we won't be able to answer individual medical questions like, I have this disease, what treatment should I engage in? However, we do have a lot of information that can be extremely useful for people in trying to make changes in their health and changes in their life. So let's go ahead and get started. Okay, so there are many things we could talk about, and I'm hoping that we get to lots of them. But given our mission that we've been given, I thought maybe we could start by getting each of you's perspective on what do you see as one of like the core activities that you would like to see your population tackle to live a healthier life in 2018, and also a little bit about maybe what can you see that would make it a challenge for them. Do you want to start, Dr. Bernard, or should we head back down to the end of the list? Okay.
Okay, thank you.
We don't want to leave you alone over there. So yeah.
Right. Well, I'm here really to talk about the impact of stress, which really is across the ages, across the conditions, across, and none of us are free from stress. And there is such a thing as normal anxiety, normal fear, which really comes to us from the demands of day-to-day life, even without anything extra. Demands of day-to-day life may make us full of stress. So the idea is really to manage our stress the best we can to enhance our health and well-being. And there are 4 simple things we can do actually to promote health and well-being, and I hope that some of it might be even across conditions or age groups even. So one of them is social support is known to be one of the most effective ways of reducing stress. Meditation is another. Sleep and rest is another, and exercise and diet is another. And within that, I want to also plug in yoga, which has been increasingly been utilized for really stress management and kind of borders exercise and meditation. So I think those are very useful ways of managing stress for day to day.
So you mentioned that life is stressful.
Yes.
How would I know if my stress is like something I need to be doing better with?
Concerned about?
Yeah.
Well, again, fear, anxiety are part of day-to-day and normal life, and as a human condition. But if we begin to see that our anxiety and fear is persistent, consistent, and is beginning to interfere with our functioning, that's when we need to become a little bit more concerned. By functioning, I mean if we are going to school, if we can get up to go to our classes, or while we are in class to pay attention and concentrate. If you're working, we are not able to, be productive at the workplace, or our relationships are in jeopardy because we are irritable and tired, and we don't have enough to bring to our interpersonal relationships. Those are when that we know that the anxiety and stress is kind of going to the place where we need to ask for help.
Yeah, it especially seems like that irritability might be a good marker. I mean, we all have bad days, but if it's kind of like, I may have to kill all of my, coworkers, that's probably, I'm kidding, but that's probably, we're starting to get to that. Okay.
Right. When again, we are human and we get irritated by things that are happening day to day, but if the irritability becomes constant, and we get triggered by smaller and smaller events, then we need to really pay more attention to that.
Okay, thank you. Dr. Redmond?
Well, I want to just reemphasize, you mentioned exercise, and I think that's actually one of the things that can help with stress reduction.
Correct.
We know that stress can also contribute to things like high blood pressure, so we over in Heart, Lung, and Blood really want to address those types of things. And so we encourage that one of the habits for 2018 is to really thinking about increasing your physical activity. It can manage stress. It's also been shown to help manage high blood pressure, maintain healthy weight, and then I know my colleague here in aging will agree that it's also contributes to healthy brain health and in preventing cognitive decline as you get older. So exercise is kind of the wonder drug.
Right.
And so we really encourage you, we have American Heart Month coming up soon, and we want you to move with heart. So we at NHLBI are promoting increasing your physical activity with hashtag Move with Heart. And if you want to learn more about that, please go to our website and show us how you're moving more and give us some ideas.
Okay, so it sounds like, and you guys, and I think you are too, at National Institute on Aging, are trying to come up with programs that can support people in sustaining these changes. Because, I mean, I think pretty much every one of us is like, oh yeah, 2018, I'm going to exercise more. But then we don't. Mm-hmm. And so it sounds like you folks are working on a thing. And then I think, Dr. Bernard, you also mentioned one when you and I were chatting earlier.
Yes, we at the National Institute on Aging also think that it's very important to exercise, have a good diet, manage stress, have a good support system. Of all of those things that you mentioned, if you were looking for the fountain of youth, perhaps exercise is it. There are lots of different studies that suggest that people who exercise regularly have better health outcomes, whether it's because they have less heart disease or less stroke or less stress. It may be helpful for brain health as well. That's not yet conclusive, but it certainly doesn't hurt. And in fact, we have a program called Go for Life that we have developed to help sedentary older adults get up and about and active.
So kind of that fundamental challenge of how do you get people...
Exactly.
Okay.
Someone who's lived 60, 70, 80 years of their life, they will often say to you, why should I? But we have really good evidence to show that if you do get up and become active, you can forestall the likelihood of becoming disabled. You'll, in general, feel better, and you may well benefit a lot of these illnesses that our institutes represent.
And you shouldn't feel obligated to, I think a lot of people think of physical activity of going to a gym and doing, an hour of exercise. And, of course, if that's what you like, then by all means. But, a little bit every day. We recommend getting at least 150 minutes per week. On average, that's about 30 minutes 5 times per week. But for some people, it might be maybe 10-minute sessions 3 times a day here and there in what you can. And just increasing moving more, whether that's walking from the farthest spot in the parking lot, taking some walk breaks during your time at work or in the office.
Or gardening.
Or gardening.
Or housework. There are lots of things that can count towards that.
Right.
Yeah, and that seems to be a consistent message across the both of you. It's like, do something.
Just do something.
and that it'll help. And then, of course, kind of a more structured exercise program might further those gains, but even the small things, changes in your life, really matter.
Yeah. Actually, I want to plug in for do and then not do.
Okay. Oh, there you go.
Which
all
brings
right.
in rest and sleep, and so that when we do, it should not be in the expense of other aspects such as resting and sleep. I also want to put a plug in for meditation and mindfulness practices, which are found to be impacting the brain in a positive way, actually. So,
and is this for mood and sleep, or where are you seeing the impact of the mindfulness?
Mindfulness really impacts health and well-being at all levels.
Okay.
It's at physical, psychological, even spiritual level, and those benefits really have been demonstrated in the past 15 years more and more. The studies are stunning. I mean, they exponentially have been more and more studies, and also more funding, which results in further studies, which is still developing. But even in terms of slowing down the neurodegenerative process of aging, there are studies that support that. So I want to respond to what Dr. Redmond were discussing, which is very true. It doesn't have to be 1 hour of meditation a day, because that's a daunting task for anyone. I think you can start slow and build on it, or not. So any amount you do is better than not engaging in something like meditation or mindfulness.
I think it would be interesting, however, for you to share a little bit about what people can do to help in changing their habits? Because
Yeah.
one of the things I always ran into when I was seeing patients was they'd say, Doc, how do I do this?
Yeah, or they would say, "Oh yeah, for sure, I'm going to do this, Doc," and you'd see them a month later, and they'd be like, "Oh no, I didn't."
Exactly.
Yeah. So we know through the research of NIH and other institutes, broadly speaking, we know a lot about the science of health behavior change. And one of the things we know is that it's difficult. And the reason that it's difficult is that there are many things that are pulling on our lives. And a big chunk of them are not pulling us in the healthy direction. You were alluding to some of this. Mm-hmm. It's like, I have to get home, I have to feed the kids, I got to put something on the table, I got to pay my bills, I got to get to, it can be very challenging to find space in your life to really make a behavior change. And I think that becomes even more complicated when we think about something like smoking, because smoking is an addiction. So now it's like it's beyond a habit. We're now struggling with an addiction that is similar to the addiction of opioids or alcohol or heroin or whatever drug you want to think about. And so for me, when I work with patients, across multiple health behaviors, whether it's physical activity or diet or smoking cessation or substance abuse or depression, the number one thing where I want them to start is to stop and really think about what's going on in their life. What's going on that's going to make it easier for you to make changes, and what's going on that's going to make it harder for you. And I think once you do that, you start to be in a place to make a plan that can be more effective for you. So.
Well, that's very interesting. And from the angle that I work from is sometimes the idea is not to stop a habit, but to develop the habit. Do you have any...
Like meditation.
Like meditation. Right. So do you have any tips for us and our viewers? Or
Yeah, I think so. Where I think, again, is a great place to start in this is to really take the time to think about why. Like, why do you want to either add something new or take something away? Is it because your partner is haranguing you? Well, that's probably not going to give you the best sustained motivation. Is it because it would actually feed something that you want to do? Like, I want to be around for my kids or my grandkids, or I want to go see my daughter's wedding, or, the things that really matter to you on the inside. Because, let's face it, if you're doing it because somebody nags you, and one day they really make you mad, then you've just completely lost motivation to change that behavior.
Correct.
So I think finding what your values are. And then I think you take that and you're like, okay, how is this going to be hard? Well, it's going to be hard because, let's just take smoking. Joe's going to offer me a cigarette. Okay, it's going to be hard because everyone goes outside and takes a break at work to smoke. Well, what's going to make it easy? Well, we don't allow smoking in my house. And then figure out how you're going to navigate those things. And fortunately, there are some really, really good strategies that people can get access to for free that can help you with that.
One neat thing is, in talking about maybe stopping some habits and starting others is, with your example of cigarette smoking, for example, a lot of people do it to relieve stress. But then a lot of people also exercise to relieve stress. And so it might be that the 15, 20 minutes that you usually spend outside smoking can maybe now be spent outside taking a walk.
Yeah, I think this comes back to your exercise, maybe kind of the golden ticket. I forget exactly the word you use, but fountain of youth. The fountain of youth. The exercise is a great way to relieve smoking cravings, hunger cravings, stress, all those things that start to seize up when you're getting older. So yeah, I think exercise hugely valuable.
Absolutely, and I think a lot of yoga was developed to support meditation, basically, the sitting meditation. So it's not like yoga was developed by itself. So they really go hand in hand, and I think a lot of people value yoga as a form of exercise, which is a great way to also become more reflective about what you're doing. And I think the two hand in hand could really enhance health and well-being quite powerfully. And
the mindfulness ties in really well with your saying about kind of being aware of why you're doing things and not doing things, and why you want to make changes. So I like the idea of movement as a mindful movement, or a moving meditation, so to speak.
Exactly.
I'm sorry.
Go ahead.
For the older adult, I would just say that you're never too old to consider that form of exercise, and it's a great form of exercise for older adults.
Right.
From the standpoint that not only does it help with mindfulness and stretching of joints, as you need to do as you're getting older, but it also helps with balance, which gets to be a challenge.
Oh yeah, that's a big. Falls are a huge problem.
Yes, absolutely. Flexibility, strength, and balance are really strengthened by practice of yoga, not only because you're moving your body, but it is also because you're coordinating your mind and body together. And I think those mind-body practices more and more demonstrating how important that is. And actually, even in the field of smoking cessation, mindfulness-based practices have become very common and are very successful, actually.
Yeah, mindfulness interventions are something we're starting to see across multiple health behaviors, and a growing body of literature about that.
And in particular, that helps with craving, which is a key component of most addictions and relapses. So.
Well, speaking of craving, one of the challenges with smoking cessation sometimes is wanting to put things in your mouth. And so let's talk about how to manage that. One of the other challenges, I think, or popular things to try with the new year is to modify your diet and improve your diet. So at NHLBI, we have a lot of evidence around the dietary approaches to stop hypertension, also known as the DASH diet, which is, really kind of a good old fruits and vegetables, high fiber, low-fat dairy, lean protein. And one of the important things is reducing your sodium intake. And so sodium is great for preserving food. So you see it a lot in your packaged and shelf foods. It's surprisingly even in baked goods and sweets. And, in addition to what you might add when you're preparing foods.
How can you avoid that? Like if I'm like, here's my package I just bought, how do I go about kind of figuring out if this is something that has high salt in it?
So, one thing is, at least in a grocery store, you can look at your packaged foods and look at the label on the back, and the nutrition facts includes how much sodium. And then if you're dining out, a lot of places now are usually upon request, will provide you with the nutrition information, and so you can actually see how much might be added to foods, and try to make some decisions accordingly. The recommendations are for most people to have less than 2,300 milligrams of sodium per day. And, for some people with other health conditions or at higher risk for heart disease, we actually want that to be a little lower, around 1,500 milligrams a day. And to give some perspective, a lot of the studies that show the importance of low sodium actually had even lower thresholds. And so the equivalent of, say, about a half teaspoon of salt. And so it's actually to achieve that, if you try to eat a lot of fresh foods, because things fresh out of the garden, fresh out of the produce section, don't have salt added, don't have sodium. Other than
after I cook them.
Until you actually cook them. Well, they have enough naturally occurring sodium. So you do need sodium for kind of your natural biological processes, but the plants get enough. And frozen is another option if fresh isn't convenient or affordable. That tends to have less sodium, say, compared with canned or other prepared foods. So that's one strategy. And then just being mindful, just kind of keeping a tally of what your intake is based on.
I know you've talked about mindful eating
again
before we started talking today. We had the best conversations before we started.
Actually, more and more it seems like mindfulness is a super skill that will, permeate different aspects of life. Eating, walking,
Can you provide like a kind of a quick definition of mindfulness?
Sure, absolutely. Mindfulness has been repeatedly defined as paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience.
Well, that's a nice definition.
That means...
I get the impression you may have practiced that definition.
Well, I have talked about this very often, and so it really is to be in touch with your sense experience.
Mm-hmm.
Mindfulness is really to be aware. And that's the simplest way to define mindfulness.
And what if I don't like my sense experience?
Well, you stand side by side it, because this has particular implication for pain management.
Yeah, definitely, I would think.
Because there are things we cannot avoid.
Right.
And ultimately, avoidance does not work. Even with anxiety, fear responses, people tend to want to avoid things. But avoiding is not the answer.
Right.
I think being able to stand side by side your experience and making room for it in your consciousness is the response. And that's what we work on in terms of creating the ability for the individual to say, yes, I can do this. I can have this amount of anxiety and still function. And when we are able to make that space, paradoxically, pain goes down, anxiety goes down. So it's really an attitude with which we come to the table.
Yeah.
And so...
And it's great because I like the non-judgmental part. Because I think a lot of people, when you have these resolutions for the new year or trying to make these changes that can have hopefully a long-term and huge impact, sometimes it just takes a really small incremental change.
Right.
And like you said, I'd rather a little change than none at all.
Right.
And so even if it's just a few steps,
absolutely, absolutely.
Trying to reduce your sodium just a little bit.
So I want to switch gears just a little bit, and then I want to go to the Facebook page and pick up some of those questions. But before we do that, I would like, and I'll do this too, so it's not just you guys, but I'm curious about, if I were a patient of yours, what would you tell me for the benefit? Why would I make this change? Not my personal stuff, but what would be the benefits for me to make this change? So let's say I'm 76 years old and I like sitting on the couch watching TV. What would be some of the benefits for me to get up and engage in the Go for Life? That's the name of the National Institute. Okay, and I'm sure that must be on the web.
Yes.
Yeah.
It's Go #4 Life.
Okay.
.nia.nih.gov. But if you just Google Go
for Life. Yeah.
You should be able to get it.
All right. So
why
what is this going to do for me?
Yeah. I'll tell you the story. The first patient I saw as a young faculty member.
Really?
Came into my office. She was only 71 years old and could barely climb onto the examining table. And what she said to me is, Dr. Bernard, I don't want to get any older because I'm just going to be disabled and a burden for my family.
Right.
And the information we now have says that if she can motivate herself to start walking and working on her balance and stretching, that she has a significantly decreased likelihood of becoming disabled and becoming that burden for her family that she's afraid that she might become. Now, for every person, it's something different, just as you said. They might want to be able to be at the graduation or at the wedding or whatever. So you need to explore and figure out what's important to that individual. But the point of good exercise, good diet, adequate rest, a good support system, working with your primary care provider to make sure that you're looking for those asymptomatic or conditions that don't cause symptoms, that can cause problems like high blood pressure, cholesterol. All of those are things that, as you get older, are very important and can allow you to live a long and good life.
Okay. Yep. All right. I'll do it.
And then we'll see each other next week.
Yeah, and then I'll tell you I did. Dr. Emil, what are some of the benefits you would want to tell a patient who says, let's just even focus on, I'm going to try to manage my stress. I'm going to be doing the things that you said. What might I anticipate as a benefit?
Better quality of life. really. It boils down to quality of life, what is meaningful to you.
Mm-hmm.
And I think the more stressed we are, the more tunnel vision we get. And the less we can, the less we can see of the good things. Our brains are designed to pick the danger, the negative. So in order to see the whole picture, we need to really intentionally open up our vision of things. And I think when you talked about thinking about the values of the person, I think that's very important. And you also mentioned, Dr. Bernard, that it is important to get to know who the person is and what matters to them. So what is it that of value to me? Is it of value to be healthy and to be, in good spirits and be able to be loving and compassionate towards the people around me?
Dr. Redmond, what about so I know you talked about an exercise program, you talked about a nutritional program you have. Obviously, you're a physician who's worked in these contexts. What would you say is the value to, what are you going to tell your patients they'll get out of doing these programs?
Right. So once, we've established that this is something important for the patient, I think that, the hope is that we're going to prevent things that might cause, future impairment. Or if you're already showing signs of disease or early disease, we can prevent progression, and so that things don't get any worse.
That actually seems like a big one to me.
Yeah. So, that at least, you might, and especially particularly as you age, you might start to have some impairment, but then, let's do the best you can with what you have, and hopefully not progress. And we talked about social support. I think a big motivator for a lot of people is being able to interact with their loved ones and contribute to their communities. And it's a lot easier to do that when you feel, healthy enough to do that and to participate. And so, and I think also some people want to be around as long as they can be for their loved ones. And so the thought of preserving the highest quality of life with as minimal impairment or impact of that impairment on their life is a huge motivator.
Yeah. I think also in terms of the populations you guys are talking about, not becoming a burden to the family becomes a big motivator as well.
Speaking of family, we have a Facebook question. One of our viewers is a 46-year-old woman, generally healthy, not overweight, but a history of heart disease in my family. She says, I do not exercise at all, sadly. What amount and type of physical activity is best for me? So I really want to hone in a lot of things we don't talk about sometimes is family history, and that can really highlight someone's need to at least explore a little more with their healthcare provider about needing to do more around lifestyle modification like we've talked about, if indicated, maybe some additional screening and testing to really assess what their potential risk would be for future heart disease and to really go around that. And then specific to that question is how much per day. We mentioned at least 150 minutes of moderate or activity. Vigorous activity is fine as well.
In a week, right?
Within a week.
Okay.
So on
For
average...
There, I thought you said day.
Yeah, I'm sorry. Yes, I misspoke. So about 30 minutes on average for about 5 days a week. More as tolerated, more as you enjoy. Again, physical activity is an opportunity for a lot of people to do things, with, like, say, team sports or Zumba, like I used to do, and or other fitness classes.
Correct. And I just want to also again emphasize how hard it is for a lot of people to develop a new habit, or they haven't exercised at all, to begin doing the 30 minutes. So my recommendation is to start small and don't give up. Okay. And unfortunately, when we set goals for ourselves and do not meet the goals, we become very self-critical and we lose heart, and it really works against us. So my motto is, whenever you didn't do what you said you do, start over. Start over without self-criticism.
And this is a huge thing in smoking cessation.
Right.
So in smoking, it's incredibly common for people to have made a quit attempt and then they fall off the wagon. They relapse in that. And then what they do is they beat themselves up.
Right.
They fell off the wagon. There's a really nice campaign that's just been put out recently by the FDA, and NCI is also working with them on this. It's called the Every Try Counts campaign. Every Try Counts campaign is really trying to get people to recognize that every time you try to make a quit attempt, that is progress. So it's not that you failed,
Absolutely.
it's just that you haven't finished yet. And I do want to quickly put in a plug for why you should quit smoking. And then I want to get back to the Facebook page. So, and I'm going to take a slightly different perspective on this. A real common question that I get in my practice is, I've already got heart disease, I've already got arthritis, I've already got cancer. Why would I bother to quit? And the answer is, your likelihood of having fewer side effects in treatment, responding better to treatment, having fewer additional health problems, and potentially getting better are all greatly increased by quitting smoking. And so that becomes a very, very important thing for people to keep in mind, that when everyone says it's too late, it's not too late. It's never too late to get benefits from quitting smoking. All right, let's jump back and let's see. The very bottom one says, what are some...
The best ways.
Some of the best ways to find social support and aid in resolutions to live healthier. And I think this points to two things potentially that I'd love to hear what you guys have to say about this. One is, our family is not always our best support, especially if it's something that we've annoyed them in doing, and so they may nag and not be supportive. And some of us don't have really good families. So what are your thoughts in your populations about how they might seek out additional social support?
Well, for the older adult population, oftentimes there are senior centers that one can take advantage of. The Y system is now implementing exercise programs based upon research done here at NIH that demonstrated that you can forestall the development of diabetes with exercise, et cetera. And other sorts of groups out there that they can take advantage of, walking groups in malls, et cetera. So I think perhaps because there's a little bit more flexibility time-wise, there are also more options and opportunities to take advantage of support groups that will not necessarily consist of one's blood family. And in fact, you find that older adults often are very motivated because they recognize that taking charge to a certain degree of their life and their habits can potentially be helpful.
Okay, good.
And since we're on Facebook, I want to talk about virtual support.
Oh, yeah.
And so, I think, again, I mentioned that we have this Move with Heart challenge, and that you can have a virtual community of other like-minded individuals that are looking to improve their health in the new year. And I know personally, when I'm sometimes these virtual friendships also, if you figure out, we're in the same neighborhood. And so then you're actually growing your social support network that way. So that's a unique way to approach it. So sometimes if you don't have those people in your community or directly or in your family, or it's been cold lately, and sometimes you might not really want to go out and see people. There's also ways to get that virtual support.
And in fact, within the smokefree.gov resources, we're on about a half a dozen different social media platforms, all with the focus of trying to give people support. So Twitter and Instagram, Pinterest. But I think our biggies are, we have two Facebook pages. One is the Smoke Free Women Facebook page, and then the other is the Smoke Free Us Facebook page. And both of them are specifically designed to offer additional social support to people as they try to quit smoking.
And it's interesting because that social support, a lot of times you'll get new ideas, or, especially if you think about people who might be more like you, have lifestyle like you, have the same challenges, and they might find some creative solutions and strategies to help incorporate these healthy living behaviors.
So we've talked a little bit about community-based resources, some about kind of social media-based resources. Any other thoughts on, let's say I'm new to a city and I'm really trying to, get back into exercise? Like, what do you guys think I could do?
I think, again, some of these virtual type groups might be helpful. And then I know I'm relatively new to this area. So
what strategy are you using?
Well, we have a lot of places. I try to be a tourist in my own town, and there's a lot of walking and using the public transportation and getting around. And so, and then, you meet people, and, even your work colleagues can be sources of support as well. So,
and it also does seem like, at least here in the D.C. area, and I assume other places, there's a lot of clubs around specific hobbies that you might be interested in.
Right, and actually a lot of meditation groups have been forming all across the country, I think. I mean, if you look them up, you find people that you could sit with, basically, and meditate with. And I think I highly recommend those because another one of the things that helps developing new habits is to do it with a community. To be part of a community who does that, and then you become, more into it. Most religious practices in the world have some sort of community that they get together, whether it's a synagogue or a mosque or a church. So it speaks to the power of the group and having a community. And I think, there are exercise groups. There are, even if not offered for free, one can even initiate one on their own and get other people interested. I've had people who have moved to other parts of the country where they started, let's say, a meditation group, and they successfully did that. So sometimes we could initiate those activities that we think they are lacking. So.
Yeah, shy people like me would probably avoid that completely, but it's a good idea. I want to jump to one of the questions that I think is actually, it's related to social support and it's related to community. And I think we'll start with you, Dr. Bernard, on this one. The question is, my parents are getting older and it seems they're having trouble remembering things. How do I start having the conversation with them about Alzheimer's disease, dementia, long-term planning, and making sure they're going to get the care they need for the future?
That's a great question, and I would hope that everyone would start that conversation actually even before you start seeing problems. But yes, if you're seeing problems, one of the ways to get that conversation going would be to bring up the example of others who have encountered that. Many times, especially if it's your parent, and even if you're 50 or 60 years old, they'll still see you as little kid.
True story.
And so you can bring up the example of a friend or a relative who went through the severe illness of their parents and how they were prepared or not prepared, and then to say, well, maybe we should talk about that as well. I would certainly caution that yes, memory problems that you're seeing in a loved one could be a sign that they're developing a dementia, Alzheimer's type dementia being the most common, but it could be that they have a new intervening illness or they have a problem with their medication. So you definitely need to get them to see a healthcare provider to have them evaluated and see what really is going on.
I definitely think of like urinary tract infections as being something that can trigger a lot of problems.
Absolutely. And those are fully reversible.
Right.
So it's a matter of taking advantage of past experience to start the conversation, or even a television program that addressed something like that, and then working with your parent to make sure that they get to see a healthcare provider, and that you provide information to the healthcare provider as well as the parent providing that, and seeing where you're going. But it's even better if you can do that sort of conversation before there's a problem, so that you really know what your loved one's preferences are.
And it's not necessarily just one conversation.
Absolutely.
Ooh, that's a good point.
And I think, from my past life as a primary care physician, I would, have these kind of initial conversations. And sometimes, that, this is kind of a new thought, or people don't like to think about, too far in the future. And so it might take a few conversations.
And it might change.
And it might change. Preferences might change over time. So it's important to kind of revisit these types of things over time.
So one of the things I often do is I just acknowledge up front that this is a difficult conversation. You'd be like, Mom, I don't really want to have this conversation, and I think we have to have this conversation.
Yeah. What often happens is that you have the adult children living a distance away.
Right,
and they pick up on a difference when they come for Thanksgiving or for Christmas or whatever.
Yeah, that they weren't aware of.
And in fact, there might even be a sibling who lives closer and didn't recognize because they saw the whole
so gradual.
Yeah.
Right.
And that can lead to a whole different dynamic. But the bottom line is that everyone needs to get together and talk. And you need to work with the healthcare provider to find out exactly what's going on.
Excellent. Yeah, and good luck.
I think we have a question for you. Could you explain the relationship between blood pressure and heart disease?
Yep, this will have to be our last question.
Yeah.
So make sure you sound very authoritative and science.
Well, do it in less than a minute.
And less than a minute. Well, lower blood pressure, keeping it in a healthy range, helps prevent heart disease. If you've already unfortunately had any kind of heart events, have heart failure, or have had a prior heart attack, keeping your blood pressure in the recommended ranges helps hopefully prevent a recurrent and help you, again, as we mentioned, prevent progression of disease. And so I think to make it brief, and of course we have more information at www.nhlbi.nih.gov on a number of different health topics if you want to learn more about that in particular, since we're a little short on time.
All right, good answer.
Excellent. So we are getting close to ending our chat session with all of you. So I want to just check in with everybody and see if there is any last remarks people want to make.
Let's start with you.
So as a wrap up, just remember the fountain of youth is exercise. And if you were an older adult or have an older adult in your life who you'd like to see get up and about, more active, it's go number 4 life.nia.nih.gov, or just Google it, and it can be very helpful.
What I want to mention is I've alluded to some of the resources we have at NCI a couple of times, and I've alluded to the fact that there's lots of free resources out there to help people quit smoking. So one of them is the Quit Line. So these are where you call a number and you actually speak to a live human being who is a trained cessation counselor, and they can help you to develop a plan that will be specific to you in helping you quit. Again, that number is 1-800-QUIT-NOW. And then also, if you go on the smokefree.gov website, you'll see telephone numbers for both that number and also NCI's Quit Line. In addition to that, many health insurances provide coverage of the medicines that can help you quit smoking for either very low deductibles or even free. These medicines are important tools, and they can double or even triple your chances of success. And you even do a better job of successfully quitting if you combine those medicines with behavioral treatments. So the kinds of things that if you saw myself or Dr.
Ameli.
That's how I was going to say it, Dr. Ameli in our practices. However, it also turns out that a lot of those treatments can be delivered by what we call mobile health or mHealth. And the smokefree.gov program, like I was talking about earlier, is NCI's flagship health behavior change program. We have 7 mobile optimized websites, 15 text message programs, 2 smartphone apps, and about a half a dozen different social media channels. You can get access to all of those by going to smokefree.gov.
Great. Okay, so I think it's typical. A lot of resolutions are around increasing your physical activity and adopting a healthier diet. I'd invite you to go to www.nhlbi.nih.gov to look for more resources. If you and if you're interested in getting a social media community around you, increasing your exercise, look for hashtag #MoveWithHeart, and you might see me there joining. With my colleagues' support in the near future. So best wishes on your healthy journey for this year.
Thank you very much. And if you need any information about various mental health disorders and their research, please look up the NIMH website, and there is tons of information on it. And in terms of Healthier 2018, Please remember to meditate and exercise, eat well, and spend time with your loved ones. And so that's it for today. And thank you everyone who watched the stream today and sent comments. And a big thank you to our wonderful panel here. And this video will be available on the NIH Facebook page shortly, and NIH institutes and centers, and will continue to answer questions we didn't get a chance to answer today. So thank you again. Have a great afternoon. From the NIH family to yours, we are all wishing you a happy, healthy new year.